Hello
Okay. Hello
again.
again. Yes, I'm here.
Nice
Yes.
to see you again, again.
Oh, I see that people are joining
Yeah,
us.
we will give them 2 minutes to just join us.
Okay,
I'm
yes,
very
yes,
interested
sure,
to.
sure.
Yeah, we are very interested to hear from you, Aga. You are one of the great influences for this topic, actually.
Oh, it's very nice to hear it from you because I'm not feeling this way, but it's very nice.
Thank you
Very
so much
very
for
kind
joining us.
words.
Yeah,
Yes,
we'll give
yes.
them a couple of minutes,
Okay.
and yeah, in order to just make the people join. What do you think? We can just keep this video or sits this live in Instagram. We will not delete it, huh? We don't
Yes,
remove it.
yes, okay. Yes, it's for
Okay.
me it's
Because they
fine.
are keeping sending me on another phone. Can we keep the live? Because we don't, maybe we cannot catch the live right now.
Yeah, I
So
know,
of course
because
we will
life
keep
is
it.
life.
Yeah.
So, yes, you cannot record it, anything like that. So, if you are not not have time right now, yes, I understand this. So you can keep it wherever you want.
Okay. Let me just introduce you to the audience in two language, actually, because we have too much Arabic people is attending there, and we go back to English.
All
مرحبا
right.
بكم، إن شاء الله تكونون بألف خير. ويانا أجانا سيسكا اللي هي واحدة من أبطال الاندودونتك تريتمنت ببولند، واحدة من الشاطرين فعلا بهذا المجال. اللايف اليوم إن شاء الله راح أتكلم عن البروكن فايل، شلون راح تاخذ decision how to make decision تتعامل وياه. اكيد اللايف راح يكون ممتع. هذا اللايف الاول ان شاء الله هذا راح يكون بهذا الشهر، واللايف الاخر راح نعلنه بعد يومين باذن الله، ويا واحد من الابطال الحقيقيين العرب بمجال البروكن فاير. Who's just editing this live. It's my pleasure to just invite one of the greatest people there in Poland, Aga. She's very active and very informative. And I was following her cases in Instagram, especially. I found she's very, let's say, can teach everything easily. So it's a pleasure to have you in this live, Aga. And actually, people were since I just announced about the live, they were waiting for to have this live because they know each one we are inviting to have a live with him or with her inside this platform. They were very kind to tell us some of the tips and tricks they have in doing in daily work. So welcome again, Aga. I think you have too much things to tell us about what you have, the magic that you have.
Yes, okay. Very kind words, very nice introduction. Thank you for that, really. So we have 1 hour to discuss the broken files.
Mm,
So I want to start actually from the very beginning because we are not born and raised with broken
yeah.
files. So we break them in the canal system. So
Mhm.
what to do to prevent to do this, or what are our mistakes? It's not a surprise when I am telling that we have to work gentle. We cannot push the file into the canal, especially in the apex area. We cannot use too much force. It's important to make a nice glide path. So the smooth path that our files are following, every another file is following the glide path. You can do it manually. You can do it with nickel titanium files, rotary. It depends actually what works in your hands. I prefer both ways, sometimes this, sometimes
Mhm.
different. Especially in the curved canals, I like nitty files for the glide path,
Mhm.
but I use a lot of the hand file as well, even
Mhm.
if it's stainless steel. Also, I think when you are at the beginning of your endodontic work,
Mhm.
it's important to um, make actually the same speed and torque limit according to the manufacturer and the files that you are using. The more you will work with the endo cases, probably you will modify this, what works in your hands again better. But at the beginning, you don't know the system or you are fresh on the market and the market, so it's easier to work with the speed limit and torque that is actually mainly made for this particular
Sorry to
instrument.
just interrupt you. Among them, do you prefer or do you recommend some of the brands belongs to the files that you are using?
Uh, it's not also a big surprise. I am connected with one brand. I am using the files from 2018. I work with Fanta files.
Hmm.
Probably most of you know it,
Hmm.
like know the system. But
Hmm.
before that, I really like the Densplay, the ProTaper files. Also, I used to work with the reciprocation mode with the Wave 1 Gold, but right now, not. I'm not into the reciprocation mode actually. That was my favorite, but right now I mostly use Fanta, but there are a lot of great files. Actually, the 5 years ago and this period of time, they are really nice with the alloys, with the cross section, and Neonity, for example, are really, really nice. I don't know what is popular in your area, what you are
Actually,
working with.
actually, they are going with rotary more than reciprocation. One of the things that I just noticed because we're working on research. I will be happy to send you the paper. We were using the reciprocating files, and we find that immediately we'll have some cracks inside the canals, inside the
Yes,
dentin.
yes,
So
it's
most of the
what
people
Professor,
stop using.
yeah, exactly. It's what Professor Versiani told me years ago, and actually they also made research on that, and
Yeah,
the same conclusion was, so I gave up on this. So, but I
yeah,
know that a lot of people likes it still.
yeah. Till
Okay,
that now, then some of them use them. Yeah.
yes. Also, what I like to add, it's a very important rule that we
Hmm.
miss. It's kiss and fly or kiss and goodbye rule. When you are going with rotary files deep in the canals, you have to go there like for 1 2 seconds and go back 1 2 seconds and go back,
Yeah.
so you cannot, less like stay in one place and for a minute and make your files, this rotary motion and the torsional stress or cyclic fatigue worse than that. So you have to be careful with that. Also, you have to also watch your file under the microscope if it's untwisted, if it's like good condition,
Hmm.
and watch your files. And also there's always a question, how many times are you using these files and sterilization cycles and everything. So um, I am lucky that I am working in a training facility, so
Hmm.
I have a lot of new files. But
Right.
when I do not, and for example, I want to reuse it, most of the cases are simpler. So I use it to the anterior teeth or premolars. I'm not getting the used file to the retreatments, to the curved canals, to molars. So I try to take the new one. And then when I use it a few times, I need a lot of the files for the breaking to our have to pay attention to the file that you are using. Also, the recapitulation, the apex patency, as well as cleaning the tool. You have to take care of the area, no debris. So irrigation is also very, very important. I think it's the most important in the whole endo cases, but shaping and always goes with good, proper irrigation. I know that the irrigation is not visible, so we
Hmm.
don't like it, and we spend a lot of the time for that, but yes. Uh, Also, when you are working with rotary files, there are two forces that are putting stress on the file. It's always a cyclic fatigue or torsional stress when we are using too much the same file. This is the cyclic fatigue, and torsional stress when you are locked in the apex area, for example, and this fragment is locked and the rest is still moving. So you have this torsional stress. So you have to have, again, the good glide path. So that is very, very important. And I think you have to follow the rules so you will be more safe with not breaking the files. I prefer also smaller sizes, smaller tapers. I don't like also the reciprocation because they have a big taper in this apical area, so it can be easily screw in to the canal. So this one I avoid.
So, my main question right now, Aga, because we always face something like that in the clinic. So, the first thing that you're thinking about when you have a broken file, ever you did cyclic fatigue, or you did mistake to choosing the correct size for the canal, or you didn't prepare the canal very well in order to have the big files. So, the first decision that I'm taking right now, if I got broken file, what I should do.
Yes, this is the main question, actually.
Yeah.
What to do? And right now there are two bigger, actually one bigger, the biggest question is if I see the file or if I do not see the file. If it's
This is the
easy
first thing.
to Yes, yes, and
Yeah.
also I really like to prevent the pericervical dentin from the damage because it's a very, very important area, like biomechanically for the
Mhm.
tooth. So I right now more bypass the file in more cases than
Okay.
retrieve the file because I do not need to see it, I just need to feel it. So I will start with the bypassing the file.
Okay.
So bypassing right now, it's for me a little bit easier. And the game changer actually for that was the file, the hand file. It's Definder file. Definder
Yeah.
is,
From money.
yes, from the money company. They're making this, but I heard that again someone is also making this, but the finder is a stainless steel file. It's a hand file, and there are only small sizes like 8, 10, 12, and 15.
15. Yeah.
Yes, and it's like D cross section, and it's stiff, but it's if it's small size, it's not stiff like you would get 40 ISO. So I use this, and I start with the 21 millimeter. Because when you are going with the length and you are taking the 25, 31, you are going to have more elastic, even if it's only the stainless steel, it's more flexible, more elastic when it's bigger length
Compared. Yes.
from the
So,
same file.
in order to clarify for the audience right now, the decision that we should take is coming from: do I see the file or not? If I see it, I can retrieve it.
Yes.
If I don't, I go the decision of bypassing. So the question that I have right now: can we choose the bypass for all of the cases?
Actually, when it's in the apical area, I consider mostly bypassing. But when it's coronal, it's
Yeah.
very rare to break the file there. But maybe someone, go crazy with the opener file or something like
Yeah.
that. And it's very easy to retrieve. So I would go with the retrieval. If it's like coronal part, it's not beyond the curvature. I would
Okay.
also go with the retrieval. So that would be easier. But when it's beyond the curvature, when it's close to apex area, then I would go with the bypassing.
Bypass.
That's the choosing path for me right now. And
Okay.
first, I will go with manual files, And when I have a catch, I go quite deeply into the canal. I have the catch. Sometimes, I just go left, right with this motion, like 30 degrees, 30 degrees, and go a little bit farther and farther to the apex. Then I mostly make the X-ray if I'm in good position. I do not use C plus pilots because they have the active tip. I can
I have a
make
ledge
the
of
false
separation.
way.
Yeah.
Yes, exactly. And definders have inactive tip. So I would go with this one. And mostly I start with the 10, sometimes 8. Then I will go with 12. Rare will be 15. Sometimes I switch
Okay.
to the K-files, but it's also easier for me when it's size 20, maybe even manually. And then I will go the rotary files and mostly the narrow one to the glide for the glide path preparing. And then again, some system to know to obturate well, but I'm not going more than 2504.
So always with bypass, you prefer to go with manuals always till the
For
end?
bypass, no, not till the end. When I have, for example, this glide path around the wall and the file, I would
Okay.
switch to rotary, but I have to have at least, I think, 20, making 20 or 15. Maybe 20 is too stiff sometimes. I also have really nice files for the glide path from Fanta. There are nitty files and they are like 1302, 1602,
Mhm.
1902, and
Okay.
I like to use them. And
Mhm.
then I switch to the 2004 and 2504, and that would be like enough 2504.
Okay. So do you have a picture for the define the? Let's show the guys or
Uh,
the audience here because we want to know.
yes.
We want to show them the key with bypass is going with defined. Actually, yeah. This is
Uh,
the
the,
main file.
Yes, this is the file. This is actually this number 10, and you can see that this is mostly
Yeah.
inactive file. It's most like a spreader between the wall and the separate file.
Yeah.
So we are making the space, but not cutting a lot of the dentin.
Mhm.
It's I think it's safe to use, and
Mhm.
I never made a false pathway with
Mhm.
this. So it's very nice. Also, what you can use
Mhm.
here, I don't know, probably you will know
The
because you do
reciprocating
a lot of
handpiece.
endo.
Yeah. Yeah.
Yes, the reciprocity. Yes, exactly.
Reciprocating handpiece.
It's actually making it faster, easier,
Yeah.
because when you are like have second endo, third endo, and your fingers you are not in the best shape right
Yeah.
now, so then you can use the reciprocating handpiece for
We
the hand
used to
files.
use this handpiece with, let's say, what I'm doing in my clinic. I always use this reciprocating handpiece when I have, let's say, calcified canal or blocked canal. I always going with this way.
Hmm. Yes,
Yeah.
but I use it actually daily. I use it
Hmm.
for the regular endo also, so it's
Uh-huh.
very easy. Of course, I go manually for the first time to,
Mhm.
feel
I
the
think,
canal and
yeah,
feel
yeah,
the apex. Where is it? How is it? And then I switch to the this handpiece for the handpiece, and
yeah,
then I use the endo. Also, what I was talking about, why I am choosing more uh, bypassing the than retrieval. There are, for example, danger zones
yeah,
in lower molars, the mesial roots. They are very, very thin and narrow, like the dentin area. When you are going for retrieval, you have to have the space, you have to go around the file and everything. So You have to be careful with that. And these are actually from the CT scans. They are in that shape, like it can happen in the nature.
Perfect.
It is. You can make the strip perforation.
Mm-hmm.
And also not only the lower molars, but even you have the shape in the incisors lower. So then I have to be really, really careful. What else I want to like put the stress that it's the length of the file that you have in the canal. So
Okay.
when you have a very long
Good.
tool, a very long file, it's not easy to retrieve. It's not also easy to bypass it,
Mm.
but it's again the choose that you have to make. So I prefer the bypassing, and this is actually the lower molar.
Mm-hmm.
It's also questionable about, treating this tooth, but already the lady was somewhere else. Someone, just broke the files inside. There are actually two files in the mesial root, one in the lingual and one in the buccal, and one was very, very like long and engaged strongly into the canal. And imagine to make, the straight axis to be visible. And I decided to bypassing. Here was the result. Actually stayed here. One was rinsed out. So when I just made the space between the wall and the file, so I could rinse it out. And it's also, the great plus of the bypassing, because it's also, as you can see here, here maybe it's not very good visible on that screen on the phone, but
Yeah.
here it's also a broken file. It's
Yeah.
some kind of H file or even Lentulo file. Here you can see it's the one
I
file,
can
and
we
here
go
it's
back to the first
again.
case with the
Oh, yeah,
curvature? Yeah. I
yes,
have a
sure.
question, special question. I don't know. Maybe some of the guys who's attending. Uh, Once I was following, Yoshi Torochi.
Yeah.
Yeah, he was talking about a technique which is, I think it's not for beginners, but I was thinking about to use the rotary and with some types of file in order to make the file that's already broken can
hmm
be movable, then he can bring it out with irrigation. I don't know what's the name of technique. I didn't use it by itself.
hmm
But do you believe that if we are just below the curvature, we can use this technique to just retrieve some such files?
Yes, but you know what? Actually, I saw some of the cases and the idea of Yoshi, but
Mm.
I think the file should be quite loose. But
Ah,
if it's like,
ah,
very, very tight and gauged in the apex area, and it's, blocked with the dentin, the debris and everything, it's not moving, it's not loose. I saw
uh-huh.
once the case when actually he had in the apex area very, very
Yeah.
nice file. Like it wasn't long, but it was,
Mhm.
already moving. It was dancing.
Mhm.
So he put XP, I think, finisher, and he, made some bubbles
Yeah.
around, and he put this away with this XP
Yes.
finisher,
Mhm.
and it was okay. But when you have a long file that is very like strong engaged into
It's
the canal,
impossible
not
to do it.
sure.
Okay.
I
Yeah.
think it's impossible to do it.
Yeah.
Yes.
Yeah. Sorry for
Uh,
interrupting you, but I just remembered this.
yes, yes. Yes, yes.
Yeah.
Just ask questions. It's fine. But what I was telling about this case right now,
Yes. Yeah.
here, you can see these two files. And actually, I didn't want to make them visible. I didn't want to make the staging platform or anything like that. I just
Mhm.
want to bypass it because I've seen, actually, I have some nice canal around this. And you know what? It was like that. I remove it by itself because when I went with the rotary file around these broken files, I just could wash it out and rinse it. So it's very also like the plus of the bypassing because it happens quite a lot to me actually. I don't know if
Yeah.
I was lucky or anything like that, but it went pretty well,
Hmm.
really. And again, what I want to put stress here, I just make it quick and go back, with the idea. But here, actually, I just removed the tool from the distal canal here, and I broke C plus, maybe not C plus, or C pilot from VDW. It was like two mini fragments here, like one is here and one is here. It's not visible maybe on the phone, but they are there. And why actually they are there one and another?
Yeah.
When I was retrieving one file, I knew that I broke something because I saw that my that instrument was
Or
shorter.
the problem.
But yes, but actually one of these I also washed out, saw in the chamber that is dancing and go smoothly here. So it was
Oh,
completely
dropped.
loose.
Yeah.
Yes, exactly. It was completely loose and went straight to different canals. So actually, what you have to remember, like every time that when you are retrieving the
Yeah.
file or even bypassing, you have to
Close.
protect the orifices. Yes,
We should
the
close them.
orifices.
What do you use to
Yes,
close them at, by the way?
Teflon tape.
Okay.
The Teflon tape. It's the easiest for me. The easiest
Yeah.
for me, and then again, I just put like very tight small ball and push in the orifices. So then I am protected, because it's not moving, it's not
Yeah.
rinsing or anything like that. And this was like, I can say, my mistake. And actually, it was too deep and too small.
Hmm.
So again, I just bypass it.
Very nice.
And bypassing is my thing, so I just bypass it. And okay, one
May
more
I ask
just
you
about
something?
bypassing. Yeah, sure.
I got sometimes when we try to maybe bypass it or we have to retrieve it. Sometimes when I'm facing a file, I'm trying to, let's say, do troughing around the files. And each time let's say the canal below the file is just empty and easy to be, let's say, to be entered. So when I'm trying to do troughing around the files start to go down. And each time I
Yes.
try troughing, I catching the file or touching the file goes down. And in this situation, what do you try to do?
It's very tough because actually, a few times I just push it more and deep, and it stayed there in the
Mhm.
canal because we have the bypassing, we have the retrieval, and the other way it's just leave it as it is, leave
Okay.
this way.
Mhm.
So I sometimes leave it when it's go just straight to the apex, and sometimes, it's so hard to retrieve, and I think it's so locked in the apex area that I just rinse, and obturate just above the broken
The
fragment.
file.
Yes, just the broken fire fragment. Sometimes I just, fight and fight till the end. And my worst case was the first one when I was able to retrieve the file, but actually the tooth was completely destroyed. And I made the perforation and
Okay.
everything. So it was tough case, and sometimes it's too deep to retrieve, and when I see it's moving, it's really dancing. I try to retrieve it with a lasso technique, which I will talk about. And also I try to move it with ultrasound. Maybe it will go up, I can rinse it. It's
Okay.
every time it's different. It's not like
The
I have a
situation
protocol
is
for
different. I
that.
totally agree
Yes,
with you.
yes, you know the endodontics. When it's like this, you try many different things and many
Yeah,
different ways. So, yes, it's like the battle. So, yes, exactly.
very difficult.
Uh, yes, and I think the last case from the bypassing, and I
Yeah,
can switch for the retrieval. It will be this one, and probably you will know and see what is this. It's the silver points,
yeah.
and
Silver.
it's not something that I want to stay with the tooth. It's not something that I want to bypass. But here you can see there is a broken instrument here,
Yeah,
and again broken instrument. It's here.
yeah.
So I have two broken files and four silver points. And
Okay.
actually, I could retrieve the silver points, but what you have to remember,
Yeah,
it's the thing that they are soft. They are too soft. It's not easy to go around with the
yeah.
ultrasound and yes, ultrasound files and anything like that. So they will easily break. So sometimes I need to have the larger fragment of that to take a look and go to with the retrieval, but
Mhm.
here I think I had the problem with one of them, and firstly I made the bypass again. It was easier to retrieve it. So actually I just take four of them, and here these two broken instruments, I couldn't I couldn't take them out, and I just, as you can see here, I
Mhm.
just bypass it, and when I bypass it with the 10D file, I just make the X-ray if I went the proper way, how was it, and here also you can see, my
Nice
files
photo.
that I yes, but I make the ledge here. Maybe it's again not very, very visible here, but
I
I made the ledge,
can see. Yeah.
making, the way for that. So sometimes it's easier for me to make the bypass in the first place, like the
Yeah.
first stage of the retrieval, because they are making loose, and then again. And here, only what I wanted to stress again, when you have the beyond curvature, because the files are not breaking in the orifices, the coronal part mostly. When you have a
Okay.
bad luck or very hard hand, maybe it happens, but mostly it's in the narrow canals and beyond the curvature. So here was actually the wisdom tooth that another dentist wants to restore with a bridge. So I tried to save it, but it is my file. I break it. And here I decided to go also with the bypass because I couldn't see it, and I think I would destroy the tooth. And it was actually asymptomatic. It wasn't anything that was painful or anything like that. So,
Yeah.
yes.
Very nice
Okay.
case. Now,
So when I can retrieve the file and it's a bypass case, uh, I just need to see the file. I have to make it visible, and we call it a platform staging, that I make the straight line axis and also visibility through the microscope, because when I have to retrieve it, I need to see it. It's the rule number one. So I make it, it's actually very common and popular to make it with the
few files.
U files, yes, but you know what I wanted to say. Actually, the
Mhm.
platform staging, it's made from modified Gates
Uh-huh.
Glidden. You know them?
Yes,
I don't
Clinton.
know
Yeah.
if you use them, because I'm not actually into Gates Glidden, because this is also how you can modify this. It's um, It's easy to make it with a sharp new Softflex disc. It's just you cut the tip and you make it totally flat, you know, to make only like a trap on around and make the file visible. You can also make it with the diamond burr and any kind of that, and then you have the flat tip. But what
Mhm.
I do not like about the Gates Glidden and this platform staging is they're pretty stiff. They are stainless steel files and they are self-centered. So they are just, you know, removing the dentin from the outer and inner wall. And what I was putting stress and showed you, there are these danger zones and, you know, different anatomy and I removed a lot of the dentin. So the idea right now is to
With
modify,
open,
but yes, orifice opener, sometimes, you know, the file with a bigger taper.
Mhm.
So I can respect the anatomy more and I can, you know, also make it visible, but, you know, not taking down a lot of the dentin.
So
So,
we go with the canal, let's say.
yes.
Yeah.
And I switched to this and it works perfectly for me. Sometimes if I broke the file, I can admit that I did not break the file in like 2 or 3 years, I think. But I'm very, very gentle and I use a lot of new files. So
Okay, like me.
that's why. Uh, yeah,
Yeah.
but I use this idea, and when I have this platform staging, so I went down to the canal and I see the silver point inside that something is, you know, sparkling. So I know there is a fracture instrument. And then I use the ultrasound, of course, to
Yeah.
make the space between the wall and the file to catch somehow the file and retrieve it.
Yeah.
So what is really actually here popular in Poland? It is I can say it's like spreader. It's without any fluids around, so it's very like thin and different ISO numbers. It's red, blue, and green,
Okay.
but it's stainless steel. It's pretty stiff. I
Mhm.
pre-bend it and I use it on the endochuck, as you can see here. So I can make the space only with the tip. I don't like these tips when you have this flutes that looking like K files or anything like that because they break easily. Like the last 3-4 millimeters, it breaks easily. So I just use this looks like spreader, um, and also. And also, you know, they are ready to use different from Woodpecker, DTE, and Spartan and whatever you want. And I use it with this device for the
Mhm.
ultrasound. And when I, you know, have the loose file, and it has to be really, really loose. And the problem is when the file is like pretty long. So I have to, you know, make the loose more of the file and more
Keeper.
millimeters and
Yeah.
yes, make the more space. So it would
Yeah.
be always more difficult to retrieve a long fragment, long instrument. So I try bypassing as I said, but also I retrieve it. So when I have like a lot of the instrument already loose, I try with retrieving, and I retrieve mostly with the lasso technique. So I have to have a loop, and then this loop is going around the broken
Look,
file. Then I
technique.
squeeze it very tight, yes, and then try to retrieve it. I can show you the one that I am using.
Yeah.
It's here, it's the Polish device, it's BTR pen from
Yeah.
Cercamet. I
I
am not
like that.
connected with them, but I think they are worldwide and they spread the instruments all around the world. So you can easily
What
buy
do
it.
you use instead of using the BTR pen? As loop technique.
Uh, as loop technique, it's
Mm.
very good question
Mm.
because the BTR is pretty expensive and the sticks,
Agree.
you know, are just single use and you can also easily break it. There are
Yeah.
different also loops, but you can make them like homemade, and you can actually have the needle that is cut very flat at the end. Then you can have
Okay.
LCD wire that is very thin.
Okay.
It's 0.5 millimeter. Then when you go with this wire through the needle and tight, very tight, it's like at the end very high tight, so you can have this, you can squeeze this loop, but it's also, you know, pretty effort. I can show you the video that is made by my friend Olga Zemliakowa here, and I think it's the easier to make, and you use the syringe that everyone in the office have,
Yeah.
and it's the syringe for the rinsing canals. You modify just the needle, the tip of the needle that is also already flat,
I,
and
I like
you
that way.
cut, yes, you cut just in a few places to have the needle, like to bend the needle, and here it goes. You go with the loop through the needle like that. You make the loop. Uh, the needle is already modified. Here. And yes, you tighten it a little and you go again inside the syringe. And you have to go around these cuts that are already made before. And then when you are going up and down, the loop is going to be bigger or smaller, and only like this. And it's very easy to use, and actually you can have it in the office already made. So your assistant can make it, you can prepare it between the patients. So already you have it in the shelf. So just take one
Very
and
easy
try.
to
Take one
do
and
it,
try.
actually. Anyone can do it in the clinic.
Of course, it's very easy. You can do it. And actually, when the loop height inside in the needle, you can go back with that and
Yeah.
you can reuse it. With BTR, when you know you just you can't. It's only single use because when it goes inside, you cannot go again outside. So this one is easier. And sometimes, for example, here you can have the straight access.
Excellent.
So of course, and beyond the apex, some kind of lentulo needles. Of course, I would try the retrieval, and patients wants to save the root for some prosthetics reasons. And actually here was the technique that we put the cement inside the needle, or you can also have a cut a little bit here. You have to have the wider needle around and try it without the cement inside. Try it around the file if it's like going tight, and try to move it, and then you can just put the cement inside, wait few minutes, but then you have to be really patient, because you know, I know from my experience that I was touching, trying if it's already set or not. It also has to be chemical cure, because you know, it has to set up not with the light, because the light won't go there. So you have to be patient with that, and then you go, you know, with just the retrieval. Also modified technique when you just cut the needle, go with the file, and also you engage the file inside that. So there are a lot of different modifications. I don't even know the names, but you know, as I said, it's like battle, like everything it's
It
possible
can
and
be
can
used.
happen.
Yeah.
Yes, exactly. And this braiding technique, when you have, for
Too
example, some
fun.
kind of obturator like thermophil, you go with one file, another file from different sides, and you know, squeeze it, try to braid, and then you can take it out. But as I said, you know, the retrieval, it's a cost of the dentin loss. So I
Yeah.
don't like it, but I sometimes do it. Yes.
What do you think about the device, to be honest, the device that I'm using in the clinic? In the past, I was using the PTR pen, but as you said, it's very expensive.
Yes.
Now I'm using Walid's device, the Leo pen. It's very nice.
Yes, I
Yeah.
have it. I have it
Yeah.
also. I also use the Leo pen. I didn't, you know, have the presentation with Leo pen because it does not have the CE in Poland.
Yeah.
So we cannot sell it
I,
and buy
I,
in Poland.
I
And I
got it.
didn't had the pictures or anything like that from that device. But Walid Kurdi also presented us this, and it's cheaper. It's like less
Yeah.
effort because the BTR is always more and more expensive with every year. And you know, when I just break one needle, one loop, and another, and it's three gone, and I'm looking still at this file inside the canal, and oh my God, I will pay for this,
Yeah.
like very hard, yes.
Yeah. But
So,
I
but
liked it too.
yes, but I, you know, talk a lot with the patient about the effort, how difficult is the case, and that it can go even wrong, and you know, it's not very predictable, and of course, he knows the risk. He should know the risk because if he is going on the visit and thinks, oh, it's just a regular endo treatment, everything is fine and going well, not really. It can end like very different way.
I really liked
Yes.
the cases and the presentation because people was confused to with it. First of all, that's why we ask about the decision: make bypass or retrieval. You always think about the dentin. This is what I
Yes.
just realized. And of course, even we put more, maybe sometimes, not sometimes, more time. The retrieval can take time more than the bypass. Do you agree with me?
Oh yeah, of course. Of course, when it's really, really s- engaged in the dentin like very
Yeah,
hard, it can get like, you know, right now I work faster than in the beginning, but
yeah,
years ago actually I took two visits, three visits. It was crazy that, you
yeah.
know, one tooth cost me like 8 hours or something. No, I just could retrieve it, but no one will pay for it, and you know, thank you for that. So yes,
I
right
go with
now is
bypass safely, and also I keep my effort. I keep something which is not expensive for the patients also. So it's a very good decision to go with the bypass. People
yes,
here,
yes, yes, especially when you are using these files for the glide path, when you have already the glide path made with definders, you
mm-hmm.
are going with this very, very thin,
Yeah,
delicate, nitty files that go around with the file and the dentin. So it's, yes, safer for me. But I take the new system, the new files for that because pretty
so
much to have more files impacted in the canal,
sure,
it's
sure. I
yes,
have
it's the risk.
I got some questions from the audience right now. I got, if you don't mind, I can ask them. Uh,
Yes.
the first question I got is, do you prefer to use some oils in the retrieval process?
Not really. I mostly use hypochlorite, sodium hypochlorite. It's always because I want to dissolve the tissue that can remain there or something like that. I do not use any oils. Sometimes I have EDTA actually in cream, but it's something that I guess get used to it from the university. I just raised with this, and sometimes, you know, it's just my thing that I am doing, but I'm not. like, it's something necessary. Sometimes even I heard that EDTA, it's not the best way because it's easier to make the perforation or
False
something
canal.
like that.
Yeah.
Yes, false canal. So I do not recommend it. I just go with the sodium hypochlorite.
So
Mostly,
no for
yes.
oil belongs to you.
Mm-hmm.
Another question that I got. What do you prefer to use after you do retrieval? Do you prefer to go with the manuals or you prefer to go with rotary?
When I have a nice space in the canal, I will finish it with rotary files because it's easier to obturate, to make the continuous wave of obturation or even single cone with bioceramics. It's better because imagine to go only manual to I don't know what size 40. It's very, very stiff. It's danger to make the ledge and it's not recommended in curved canal, so always rotary.
Okay, always rotary. Very good. Another question we got from one of the audience here. He's asking in the curved canal, do you prefer to use the XP Indo Shaper file or there's another way which is easier?
Which canals in
Curved canal.
curved canals? No, I don't actually use the XP Endo. It's also very expensive file, so you have to calculate it with the treatment. I have it in the clinic, but I am not using to every, every case, maybe some resorption or something like that, irregularities, I would prefer it. But in curved canals, I also use this files that are for the glide path and are nitty files, nitty rotary files. I can just maybe find it somewhere and
Yeah.
show you exactly which system is that, because they are really, really nice and you can always try it because they are, I think, for almost every solution for me it works. So
So the guy who asked about the Xpinder Shaper, he's saying that it's expensive, but it's flexible and is safer. Sometimes it doesn't
maybe,
become safe actually.
maybe it's like in someone's hand, it works and it's very, very good for that. And I didn't put, the file's name because I didn't want to make it about the product or anything like that. But XP and the Shipper, they are really, really good files. I'm not telling that there are bad ones or something like that. No, I just don't use them. Actually, I
Yeah,
just don't use them. I have a few of them in the clinic because I was given them, I think, from some company. And as I said, I use it for the resorption, but not for the curved canals. But yes, they are very, very good
cool.
files. This what I am using. It's
Yeah.
here, uh, here. It's on the right corner. It's called CPAF rotary files.
Yeah.
And as
Yeah.
I mentioned, there are 1302, 1602, and 1902. So they are
Mhm.
like the taper is normal regular taper like for the manual files. So they go very easily between the wall and the canal, and they are very, very flexible. So you also can go with the curved canals, and I feel safe with them.
Very nice.
So there, yes,
Very nice. I think we got the
try it.
last question that always they asking about. If we got a broken file and it goes in the periapical area, it's preferable to keep it or you do apical surgery.
Oh, this is very, very nice question because there are a few theories about that. Because when it's in the apical area, but still in the canal, still in the root, you can observe it And it depends if it's like engaged very, very well into the dentin wall. But when it's obturated, it's, you know, like obturation and the apical area is closed and before you rinsed a lot. So you
Okay.
can just obturate above the file and just observe it.
Okay.
It's fine. But sometimes it goes like a little bit beyond the apex. And you know, this periodontium don't like it, and when the patient is, you know, biting on the tooth, he feels something. And sometimes I heard the theory it's better than push it away, just push it out from the canal, and actually the bone, the tissue around won't mind about this. The macrophages will, you know, take care of it, and it will stay with the patient forever. But at least it's not like you know, just irritating the periodontium. Sometimes you can also observe it and nothing happen. And the last option is microsurgery, because we have a very great microsurgeon here in the clinic that works, and his profession is only do this. He's not making
Don't
endo,
do
resto,
it.
nothing. He's only making the microsurgeries. He's got like 1 or 2 microsurgeries a day and
Hmm.
follow-ups and consultations, and making only this, nothing more,
You
only
don't try to
microsurgery.
go with apical surgery by yourself. You don't do it.
Uh, Actually, I am just, you know, watching and assisting him, and I know he's the best, and he's better than me because he's making like second molars, upper, lower, like everywhere, and everything. And I'm thinking about this, but I know he's operating, I know 10 years, and from I think 6 or 7 making
Hmm.
only this, and he's really, really great with that. And we observing this, and if the inflammation is around the root in the is apical lesion, so he goes with the microsurgery, or there is some pain or anything, it's symptomatic, so he goes and perform the microsurgery. But I always tell the patient truth. It's not like I'm hiding anything. When I broke a file, when is the situation that didn't go pretty well, I'm just saying that I did what I did, I could everything. So we just, you know, observe this. Please just let us know, call us, and we will think about the other solution, which is microsurgery. And actually, there's very rare, like few situations that end with this, or maybe it was broke before and it was bad before, or something like that. But yes, it's getting
Right.
more and more popular, this microsurgery. In the beginning, it was like, what, you want to make a surgery on me? Like, you know, there's a blood,
They
there's
didn't
everything. And
accept it easily.
yes, yes. And right
Yeah,
now, everyone understands that.
for sure. I really appreciate give us some tips and tricks belongs to the pipe, especially broken file. Also, people will always have the question what we should do in the beginning, and you answered it very well in the way that I realize that it can be easy to think before you do anything.
Yes, exactly. You have to
Yeah.
learn good instrumentation, good shaping, all these rules, and follow the protocol. And actually, I don't like something like single file system. The idea of reciprocation, that you can go inside after 10 hand file, you can go with 1 file and it's fine because the manufacturers say it. So I just add different size of file. I switch systems sometimes. It's not like when I don't feel and I have to push too hard into the canal, I sometimes take another instrument that will be reliable with the taper and the size for me, and change the protocol that company was telling me. So I just you know, manipulate with the files, and sometimes I add more different sizes to get it done properly and to be more safe and not stressed. I think. And
For
I
sure.
don't like jumping between files and, one system file, so it's not working for me. I have to have a good glide path and work gentle, and everything is fine then.
I really appreciate your time again because it was very, very informative live. I think the guys were very, they were asked to send me on the social media right now. I think we got the last question and we just end the live because you have something to do. I really, uh, really
It
thank
was
you for the time you
nice.
gave
I
us.
didn't even
Yeah.
know when this hour went. It was,
Now it's 9 on our side. Okay.
yes.
Some case, can you inject bioceramic obturation without gutta percha?
Uh, Uh, Very rare. I prefer maybe MTA or biodentin when it's open apex or some perforation, anything like that. So you have more this silicates inside, and it's better consistency to put it into the canal. But when you go only with the bioceramic, it's a pretty flowable, and I need to have something more, it's still the sealer. It's not for the, this is not meant to be only for the obturation, only because only with the bioceramic. I know we are getting lazy and
Mhm.
more lazy,
The one who was asking was late, I think.
uh, but not like that. I like bioceramic. I use it a lot with single cone technique, but not only bioceramic.
Very
I
nice.
prefer biodentin or MTA if it's
Very nice. Again, I
necessary.
want to thank you, Aga, for the time you gave
Oh,
us.
thank you. It
It was
was very
very nice
nice.
live, actually. You just show a lot of things to the people here. I hope that we can see you face to face, real in our countries. And I
Yes,
will work on this because it's very nice. This nice lecture that you give it in front of people attending, maybe more than 1,000 people attending your lecture. Very informative. It doesn't feel bored, especially while talking about something which is not easy to explain for
yes.
people, but you explained very well. I really thank you, and I hope can I see you again in another life.
Oh, yes, thank you.
Thank
Yes,
you so
not online.
much. Yeah,
Thank you for the invitation. It was
thank you
very nice, my pleasure, and hope to see you soon again.
for sure. Take care of
Bye.
yourself, and bye bye.
You too. Bye.